Thank you very much for that introduction. I'm here to talk to you this afternoon about our frontal lobes. What good are they anyway? Are we better off without them, perhaps? We know that the occipital lobes are very important for vision. We know that the parietal lobes are important for somatic sensation. We know that the temporal lobes are important for hearing and for memory. But our frontal lobes often kind of get short shrift when we talk about what the different lobes of our brain do. So let's look a little bit about them. So our frontal lobes, you can see that the yellow area there is the primary motor area. We talk about that part of the frontal lobe a lot because that's what makes us able to move the opposite side of our body. The premotor areas, just in front of that, are also important because they're also involved in movement, especially in how to do skilled movements. We have the frontal eye fields. That's what enables us to look towards the other side when those are activated. And down at the bottom there in green, we have Broca's area, and that's important in language production. But in front of that, we have this big area that's not really cordoned off very much, and that's the prefrontal part of the brain. And that's the part of the brain that isn't always assigned specific functions, but it's still an important part of our brain, as I'll show you. So that prefrontal cortex is what we call association cortex. So that means it has no primary sensory input, but it has, so other parts of the brain like the parietal lobe, the occipital lobe, the temporal lobe, they get input from the thalamus, primary sensory, visual, tactile, hearing input to those parts of the brain, but nothing like that really goes to the frontal lobe. However, there are extensive projections from other association cortex areas around the brain. There are frontal connections prefrontal to limbic system, thalamofrontal connections, and frontal striatal connections. So here's just an illustration of corticolimbic connections. So the limbic system is important in emotion, fight or flight, those sort of things. It also has connections to things like smell, olfaction. It has connections to memory. So without our limbic system, we would not be emotional beings. And the frontal lobe is intimately connected with the limbic system. There are thalamofrontal connections. So the thalamus has many functions. It's best known as a sensory relay area deep in the brain, but it has connections with all parts of the brain, including the frontal lobes. There are frontal striatal connections. The striatum is the part of the brain that has to do with movement. So in Parkinson's disease, that's affected and people can't move properly, for example. It's affected to some extent in Lewy body dementia as well. And we can think of the frontal lobes as having three parts. If we think of it as sort of a triangle, as I'll show you in a moment, there's the dorsolateral prefrontal cortex, the mesial prefrontal cortex, and the orbitofrontal cortex. So if we look here on this coronal section of a human brain, so we're looking at the brain cut through like this, as if we're facing this person, and here's their frontal lobes. Here's the dorsolateral frontal lobe, so it's out here towards the outside of our head. Here's the mesial frontal lobe, so on the inside here, in between the two cerebral hemispheres. And here's the orbitofrontal cortex, so down at the bottom here. So those are three areas of the frontal lobes, and we see three syndromes associated with those. So if we just go back a second, which is not letting me do, never mind. We see three syndromes that we can think about for each of these areas. Now there's overlap between those, and pathologies are seldom pure. We don't always see people who have exactly just the dorsolateral prefrontal lobe affected or just the orbitofrontal area affected. But in head injuries, these areas can be affected. They can be affected by stroke. They can be affected in frontotemporal dementia. And in frontotemporal dementia, we often see varying degrees of each of these three syndromes. So sometimes someone presents very much like this first one we're just about to talk about with dysexecutive problems, but sometimes they present with one of the other frontal lobe syndromes, and sometimes they have a mixture of all three. So these are not necessarily pure. They're a little bit like shorthand or stereotypes of what patients might look like with these lesions. So with the dorsolateral prefrontal dysexecutive syndrome, it's a dysexecutive problem. So people may do very well on things like memory tests, IQ tests, things like that, but people with these problems often fall apart in real life. So they have difficulty shifting set from one thing to another. They have trouble with abstract thought. They're not very good at planning for the future. They have difficulty deciding things. They're disorganized. They have trouble inhibiting responses. So if this is the response I usually do to something, I'm going to continue to do it even when it's not appropriate anymore. They have poor working memory. That is, they have trouble maintaining things in their memory while they act it. For example, if you were doing mental arithmetic, you would need working memory because you have to remember the numbers that you're adding together. They often perseverate and do the same things over again. And if it's on the left side, because left is important for language, they may have impaired word fluency. So when we ask them to give us a list of words beginning with F or a list of animals, they have trouble doing that. Some of the tests that neuropsychologists use are things like the Wisconsin card sorting test. Now, this, I think, is one of the meanest tests ever. So you give the person, there are 4 cards face up, and then they get a deck of cards. They turn over the first card. And for example, here, they see 3 yellow triangles. And all they're asked is, put this card on the appropriate pile. Now, you might put it on the red triangles because they're both triangles. You might put it on the yellow star because they're both yellow, or you might put it on the green ovals because they're both 3. So let's say the correct answer is shape. So they do it by shape, or they make a guess, and after a few guesses of turning over cards, they'll figure, oh, they're going by shape. Okay, so I'll just put them on the right shape. Once they get a certain number correct, the neuropsychologist changes the rules. So if it was shape, now all of a sudden it's color, and they don't tell them. So people put it confidently on the right shape, and they say, sorry, that's wrong. And I say, well, that doesn't make sense. And normal people try again, and they figure, oh, they've changed the rules. They didn't tell me. And they eventually get it, and they keep going. And then after they've gotten a certain number right, they change the rules again. But the normal person thinks, aha, they've changed the rules again. The person with frontal problems really has trouble. They're stuck. They keep going back to what worked before, and they really struggle to change set as they go along. Another test is the Stroop test. So if you have all these words presented suddenly to them, it's very easy to read purple, yellow, red, black, to just read the word. But if you're asked to say, what color are these words printed in, then you have to say red, blue, green, yellow. And you'll notice I said those ones more slowly than when I just read the colors, because it's harder. You have to resist that impulse to just read the word, and you have to look at the color of the letters and say that. So that's another way of looking at people who can change their approach and not do the obvious thing that they're supposed to do, or that they're not supposed to do. Moving on, we have the mesial frontal abulic syndrome. So that's when the problem is in the mesial frontal lobe, where the 2 frontal lobes butt each other. So these people are apathetic. They have reduced activity in speech, reduced motivation, psychomotor slowing. In the worst state where, especially when it's bilateral and severe, they have akinetic mutism, where they just sit and don't respond at all. So that's something that we might see, for example, with bilateral anterior cerebral artery territory infarcts. We might see it with an aneurysm of the anterior cerebral artery that's ruptured and damaged the mesial frontal lobe. Someone may be like this. And as I said earlier, we see combinations of these things in people with frontotemporal dementia. Then if we turn to the bottom part of the frontal lobe, the orbitofrontal lobe, some people have called this a pseudo-psychopathic syndrome. So these people are disinhibited, they're impulsive, they often have antisocial behavior. Witzelsucht, that's a term from for an inappropriate jokiness. And I remember a patient who had an orbitofrontal tumor when I was a resident. And the resident who admitted him that night, it wasn't me, when he was trying to look in his eyes, the patient kept going on about how hairy his fingers were. And this was just the funniest thing ever, that this guy had hairy fingers. And the next morning at rounds, when this resident came in, oh, there's the guy with the hairy fingers. And that's the sort of thing. They just find things that are kind of silly, very funny. They have poor social judgment. They lack tact. I had a patient the other day, and her daughter said that if she sees someone who's overweight, she'll comment on that, even if they're a stranger. If she sees someone she thinks has too many tattoos, she'll mention that to them. And often inappropriate sexual behavior. I remember one patient who had been, a pillar of the community and had been banned from the local shopping mall because he was making sexual comments to the women who worked in the stores. And he didn't see anything wrong with this, but his poor wife was just mortified because he'd never behaved this way in the 50 years or so that she had known him. So those are three syndromes: the dorsolateral frontal dysexecutive syndrome, the mesial frontal apathetic abulic syndrome, abulia means without will, and the orbitofrontal pseudo-psychopathic syndrome, we might call it, although there are a lot of differences from psychopathy there. And we can see often the orbitofrontal thing is something that we see in patients who have had head injuries, as the orbitofrontal part of the frontal lobe is rubbed over the rough surface of the anterior cranial fossa. So things we do to assess, we ask similarities, what's similar about a clock and a ruler. Differences, what's the difference between two things? Proverbs, people who live in glass houses shouldn't throw stones, things like that. Controlled word fluency, where we ask people, tell me as many words as you can think of that begin with F, or as many animals. The Luria test, where we have them do sort of fist, edge, palm, and repeat that and keep going at it. That can be hard for people with frontal lobe problems. And go, no-go testing. So one way of doing that is, for example, if I hold up my finger, and then I say, whenever I raise one finger, you raise two. Whenever I raise two fingers, you raise one. The patient with frontal lobe troubles, when they see one finger, they do one finger. And then they might say, oh yeah, I was supposed to do two. Or you can ask them, what were you supposed to do? And I say, yeah, I was supposed to do two. So they know the rules, but they really struggle to do the opposite. Another thing we can do is say, when I move my finger, point to my other finger, or look at my other finger. And again, they look at or point to the finger that moves. It's really hard for them to do the opposite and look over at the other finger that's not moving. So that's a